What are the indications to do a muscle flap during a parotidectomy? I'm Dr. Larian from Center for Advanced Parotid and Facial Nerve Surgery. The sternocleidomastoid muscle flap, this muscle that extends from your skull all the way to your clavicle, is pretty thick, right? And it has blood vessels going from above and below. It's thick and hardy and strong, and it can do most of the reconstruction that needs to be done in the parotid gland can be done with this muscle when the defects are bigger. And the good thing about it is, in time, the area that's reconstructed becomes soft and the muscle will feel like normal tissue in that area. So it's usually used, we at the center usually use it when we have bigger tumors. So if you look here, this is a big tumor there. Let me draw it actually in black. And in cross section, you can see this is a big tumor. So when this is removed, the defect that's left behind is pretty large and can be a large gap. And you can see this gap all here, right? Now, when we do a reconstruction and we take a portion of this muscle has its own blood vessel coming in to feed it. So we know the muscle is going to survive. Your body's not going to reject it. It has nutrition coming into it and it's going to do well. And we'll suture it to the parotid gland that's left behind, right? And it fills in that defect, but it also separates the remaining parotid gland from the skin, right? And that prevents Frey syndrome. And all of that can be done through a small microparotidectomy incision here, right? And this is a fantastic reconstruction. It's a very good tool that we have in our armamentarium as parotid surgeons. Now, when people have smaller tumors, such as this one, when we remove the tumor, the gap that's left behind is much smaller, right? So the two ends of the parotid can be sutured together, and then the skin can be laid down, and the SMAS layer here, which is pretty thick and hardy as well, will separate the parotid and the skin like this. So there won't be any Frey syndrome. And again, all of that is done through a small microparotidectomy incision. So you can achieve great reconstruction by coming in at an earlier point when you have a smaller tumor and have a much smaller tumor and a much smaller reconstruction without needing to use the muscle flap. When the tumor is bigger, the muscle flap is very versatile and allows us to give you a good reconstruction so that you leave looking symmetric and even with full function. If you're interested in clear parotid information and minimally invasive ways to treat parotid disease, visit us at parotidmd.com. Be well.